If you're over 50 and your legs feel heavy, swollen, or tight, especially by the end of the day, don't ignore it. This could be a silent signal of something more serious. In this video, we reveal the real causes of edema in seniors and the newest science-backed ways to reduce swelling fast. Edema, or fluid retention, is one of the most common yet overlooked health issues affecting seniors, especially for adults over 50. Swelling in the legs, feet, and ankles isn't just a nuisance. It can be a sign of deeper health concerns that need attention. And the latest research shows that managing edema early can dramatically improve quality of life, reduce pain, and even prevent serious complications like infections or mobility loss. In seniors, edema often develops because of slowed circulation, weakened blood vessels, declining kidney or heart function, or as a side effect of common medications like calcium channel blockers and anti-inflammatories. Even sitting or standing for long periods can lead to fluid pooling in the lower limbs. If you're noticing puffy ankles, shoes that don't fit by the evening, or skin that feels tight or shiny, it's time to look closer. According to recent clinical studies, nearly 1 in 3 seniors over 60 experience some form of chronic swelling. Yet most seniors don't realize it's a condition that can be treated and often improved without medication. That's exactly what we'll uncover today. In this video, you'll learn the most effective and natural ways to reduce edema in seniors. We'll cover evidence-based lifestyle changes, dietary adjustments, circulation-boosting tips, and simple daily habits that help eliminate excess fluid and ease swelling. If you're caring for an aging parent or navigating these symptoms yourself, this information is not only empowering, it's essential. Stick around, because the small steps you'll learn today can lead to big improvements in your health, mobility, and independence. Let's dive into what causes edema in seniors and what you can start doing right now to feel better and move more freely. Understanding edema. What every adult over 50 and seniors over 60 need to know about swelling and fluid retention. Edema, also known as fluid retention, is a health condition in which excess fluid builds up in the body's tissues, often causing noticeable swelling. It's especially common in seniors and older adults over 50, and it's one of the leading causes of leg and ankle swelling in this age group. For most seniors, edema shows up in the legs, ankles, and feet, but it can also appear in the hands, abdomen, or even around the lungs. The swelling might feel tight or tender, and the skin may look shiny or stretched. If you press the swollen area with your finger and it leaves a dent, that's called pitting edema, a key sign to watch for. Recent studies in geriatric medicine show that chronic edema is often linked to underlying health problems. These include congestive heart failure, where the heart isn't strong enough to pump blood effectively, kidney dysfunction, which prevents proper fluid removal, liver disease, which affects protein levels and fluid balance, certain medications like calcium channel blockers, NSAIDs, and steroids, venous insufficiency, where veins can't send blood back to the heart efficiently, and even long periods of sitting or inactivity, which slow down circulation in older adults. In seniors, it's not just a cosmetic issue. Swelling in older adults can make walking painful, increase the risk of falls, and lower quality of life. Many people over 50 also experience fatigue, stiffness, and heaviness in their legs, but don't connect these symptoms with fluid retention. That's why it's crucial to recognize the early warning signs, like persistent swelling, tightness in the skin, difficulty wearing shoes, or weight gain from fluid. And here's what's often missed. Edema may be the body's early signal that something more serious is happening internally. Heart and kidney issues often show up first as swelling, long before other symptoms appear. That's why catching it early can lead to faster diagnosis, better treatment, and even prevent hospitalization. In this video, we're not just covering what edema is, we're giving you real solutions. Understanding the symptoms is the first step. Next, we'll explore how to prevent and manage edema using natural methods backed by the latest research in senior health. Stay tuned, because swelling isn't something you have to live with. The dangers of untreated edema, what seniors over 60 must know to protect their health. Edema might start as mild swelling, but ignoring it can lead to serious, even life-threatening consequences, especially for seniors. When left untreated, chronic edema puts older adults at high risk for complications that go far beyond discomfort or appearance. Over time, that fluid buildup can damage the skin, strain the cardiovascular system, and signal deeper issues that need urgent care. The dangers of untreated edema in seniors, what you need to know before it's too late. If you're over 50 and experiencing chronic swelling in your legs, ankles, or hands, it's crucial not to ignore it. Untreated edema isn't just uncomfortable. It can be a warning sign of serious underlying health problems. And for seniors, those risks can escalate quickly. Let's break down what can really happen if you let edema go unmanaged, and what recent research says about the long-term consequences. 1. Skin damage and ulcers, more than just swollen ankles. When fluid builds up under the skin for extended periods, it stretches the skin and reduces circulation. Over time, this can lead to skin breakdown, infections, and painful ulcers, particularly around the ankles. Seniors are especially vulnerable due to thinner skin and slower healing. What to watch for? Redness, cracking or dry patches, leaking fluid, weeping edema, open sores that don't heal. Once ulcers form, they're difficult to treat, and they can severely impact mobility and independence. 2. Increased risk of infections like cellulitis. Swollen tissues become a breeding ground for bacteria. One common and dangerous infection is cellulitis, a deep skin infection that spreads quickly and often requires hospitalization. Signs of infection in swollen areas: warmth, redness and tenderness, fever or chills, rapidly spreading rash or streaks. For seniors with weakened immune systems, cellulitis can become life-threatening. That's why addressing even mild swelling early can prevent serious complications later. 3. A hidden warning sign: heart, kidney, or liver disease. Persistent edema often signals an issue beyond the surface. For many older adults, it may indicate congestive heart failure, where the heart can't pump blood efficiently; chronic kidney disease, where excess fluid isn't being filtered properly; liver cirrhosis, where protein and fluid imbalances lead to abdominal or leg swelling. These conditions can be silent for years, but edema is often one of the earliest red flags. That's why doctors recommend that seniors who develop sudden or unexplained swelling seek medical evaluation right away. 4. Reduced mobility, falls, and isolation. Swollen legs and feet make walking difficult, increase pain during movement, and can affect balance. Many seniors become afraid to move, leading to a cycle of inactivity, muscle loss, increased swelling, social isolation. Left unchecked, this can lead to a sharp decline in overall health, independence, and quality of life. Why early intervention matters for seniors over 60. Edema isn't always dangerous, but when it persists or worsens, it can signal life-altering health issues. The key is to monitor your swelling regularly. Note changes in color, texture, or pain. Act early by adjusting lifestyle or seeking medical advice. In many cases, these aren't just signs of aging. They're signals from your body that something isn't working right. The good news? Edema is manageable, but it requires action. By taking symptoms seriously and exploring effective, low-risk treatments, seniors can help prevent hospitalizations, improve mobility, and boost overall well-being. In the next chapter, we'll show you simple, science-backed lifestyle changes that can make a big difference without needing medications or invasive procedures. How to avoid edema, science-backed prevention tips for adults over 50 and seniors over 60. Edema isn't just uncomfortable, it can lead to long-term health issues if ignored. The good news? For seniors over 60, simple daily habits can dramatically reduce the risk of fluid buildup. Whether you're managing mild swelling or trying to prevent it entirely, these evidence-based strategies can help support circulation, reduce fluid retention, and protect your long-term health without relying on medications. 1. Keep moving. Daily activity is non-negotiable. A sedentary lifestyle is one of the leading causes of chronic swelling in older adults. Movement helps your veins push fluid back toward the heart, keeping the lower legs and feet from puffing up. Even light physical activity can make a big difference. Walking for 20-30 minutes a day, chair yoga or gentle stretching, water aerobics or swimming, excellent for low-impact circulation. According to recent research from the American Heart Association, consistent light activity is more effective than sporadic intense workouts for managing edema in seniors. 2. Elevate your legs. Let gravity help you. When sitting or lying down, raise your legs above heart level for 15 to 30 minutes, 2 to 3 times a day. This helps fluid drain away from the lower extremities and reduces pressure in your veins. Bonus tip: avoid crossing your legs for long periods. It can restrict blood flow and make swelling worse. 3. Reduce salt. Sodium traps water. A low-sodium diet is one of the most powerful lifestyle changes you can make. Excess salt causes your body to hold on to fluid, leading to bloating and ankle swelling. Focus on Whole, unprocessed foods, herbs and spices instead of salt, reading labels. Aim for under 1,500 milligrams of sodium per day. Avoid processed soups, canned goods, frozen meals, and snack foods like chips, which are common culprits. 4. Hydrate the right way. It might seem counterintuitive, but dehydration can actually cause your body to retain fluid. When your body doesn't get enough water, it holds on to what it has, often leading to swelling. Aim for 6 to 8 glasses of water a day, unless your doctor recommends otherwise. 5. Wear compression garments. Compression socks and sleeves are clinically proven to reduce lower leg swelling, especially for seniors who stand or sit for long periods. They support the veins and help move fluid back toward the core. Be sure to get properly fitted. Overly tight or loose garments won't work effectively. By incorporating these senior-focused edema prevention strategies into daily life, older adults can protect their mobility, avoid discomfort, and reduce the risk of serious health complications. Prevention isn't just possible, it's practical. Prevention is power. Start small, stay consistent. Preventing edema isn't about drastic changes. It's about small, consistent habits that protect your circulation, heart, and kidney health over time. These easy lifestyle tweaks can reduce your risk of swelling, improve your comfort, and help you stay mobile and independent well into your 70s, 80s, and beyond. In the next chapter, we'll dive into science-backed treatments and home remedies that not only relieve swelling, but can also reverse it naturally. You'll learn about anti-inflammatory foods, herbal remedies, compression therapies, and more. Everything seniors need to know to stay ahead of edema and feel your best. Here are the top evidence-based remedies that experts and recent research support for seniors seeking natural relief from edema and wanting to improve circulation, comfort, and mobility. Science-backed secrets to reduce swelling, natural and effective remedies for seniors. 1. Compression therapy, the #1 doctor-recommended solution. Wearing compression socks or sleeves is one of the most clinically supported ways to reduce swelling, especially in the lower legs and ankles. These garments gently squeeze the legs to improve venous blood return, prevent fluid pooling, support overall circulation. Research shows that seniors who wear graduated compression socks experience reduced leg fatigue and visible improvement in swelling. For best results, wear them during the day, especially if you spend long periods standing or sitting. 2. Herbal diuretics, nature's gentle swelling support. Certain herbal teas and supplements can help the body naturally eliminate excess water. These mild diuretics are safe for many seniors when used responsibly. Dandelion tea promotes urination, provides potassium, and reduces water retention. Ginger tea, anti-inflammatory, improves blood flow, and helps relieve swelling. Parsley and hibiscus both support kidney function and fluid balance. Always consult your healthcare provider before starting herbal remedies, especially if you're taking medications for heart, kidney, or blood pressure issues. 3. Lymphatic drainage techniques. Gentle massage, especially manual lymphatic drainage, can stimulate the lymph system, encouraging fluid to move out of swollen tissues. Benefits for seniors include reduced puffiness, improved mobility, less tension and heaviness in limbs. Ask a certified therapist or learn simple self-massage techniques focused on the legs and feet. 4. Anti-inflammatory nutrition. What you eat plays a major role in how your body holds on to fluid. A diet rich in anti-inflammatory foods can reduce swelling and support overall vascular health. Focus on omega-3 fatty acids from flaxseed, walnuts, fatty fish. Magnesium-rich foods like avocado, leafy greens, bananas. Eat water-rich foods like cucumbers, watermelon, and oranges. Pineapple contains bromelain, known to reduce swelling and inflammation. Hydration also supports kidney function, helping your body flush out excess sodium and fluid naturally. Antioxidants, berries, turmeric, dark chocolate. Avoid foods that trigger inflammation, such as sugar, processed oils, deli meats, and high-sodium snacks. Eating the right foods doesn't just reduce swelling, it improves heart, kidney, and joint health too. 5. Try gentle yoga and movement. Certain yoga poses can significantly improve lymphatic flow and circulation. Gentle stretching, especially postures that elevate the legs, can relieve heaviness and reduce pressure. Try legs up the wall pose, cat-cow, bridge pose. Combined with slow, mindful breathing, Yoga not only improves physical swelling, but also reduces stress-related inflammation, which can worsen edema. By combining these natural remedies for edema with preventive lifestyle choices, seniors can reclaim comfort, reduce health risks, and feel more in control of their well-being. These strategies are not only effective, they're empowering. Conclusion. In this video, we've explored the important topic of edema, particularly its impact on seniors over 50. Understanding and managing edema is crucial for maintaining overall health and well-being. We discussed how edema manifests, the potential dangers of untreated swelling, and practical tips for prevention and management. By recognizing the symptoms early and taking proactive steps, seniors can significantly improve their quality of life. Now that you're equipped with this valuable information, we encourage you to implement these tips in your daily routine. Whether it's making dietary changes, staying active, or practicing mindfulness, every small step counts toward better health. Remember, managing edema is not just about addressing the symptoms, it's about taking control of your health and enhancing your overall quality of life. If you found this video helpful, we invite you to subscribe to our channel for more informative content on health and wellness. Don't forget to like this video and share it with friends and family who may benefit from these insights. Your engagement helps us create more valuable resources for you and others seeking to improve their health. Thank you for watching, and we look forward to seeing you in our next video.